welcome to our channel and welcome to our midweek check-in at J&J House Call. My name is Dr. John Lucio. I practice integrative medicine and pain management in Jefferson City, Missouri, and this is my wife.
Hi, I'm Dr. Jennifer Sue. I practice conventional gynecology and integrative medicine. We are just a few days from Thanksgiving, and we are thankful for you all subscribing and commenting. Always comment below anything. That's how we get our content and we know what you'd like to hear or what questions you have. If you haven't subscribed, please do so. Always hit that notification bell right there at the bottom so you know when we've uploaded our next video. And give our video a thumbs up. We appreciate it. And we hope you guys have a great Thanksgiving. Today's a really good topic.
And I get this question a lot in my clinic. The question is, how many steroid shots should I be getting? What are their side effects, and is it safe to keep getting them?
And steroid shots are for joints, right?
Well, they can do it for joints. They can be used in the spine. I use them for pain management. And it's not an easy question to always answer because really this is something you should be discussing with your physician that's giving you these injections. But I always tell patients that classically we were taught that, especially with spinal injections, that if you're not getting improvement after each injection, you're not increasing not just your pain but your functional ability, you really should start questioning why you keep getting these injections. And I've seen patients come into my clinic who have seen other practitioners. They were getting these injections like once a month, and they can't really tell me why they were getting them and really whether it was doing you any good. Now, you should be aware there are some side effects associated with continued administration of these type of medications. One, you can get weight gain and water retention, irritability, increased incidence of osteoporosis, high blood pressure, even raises your blood sugar. So there are some significant things that you need to be watching for this. And plus, your body, after it starts to receive these steroids, it stops producing its own, so that your body becomes a little bit more vulnerable at that point. So the way I do it, typically when I approach a patient about this, most of the time when they come into my clinic, they're in a lot of pain. And my goal with these steroid injections is not just to get a certain number, and I'm going to talk about this a little bit later, but I'll start discussing with a patient. It's like, well, I understand you've had this pain for a while. We have to have two goals. One is I'm going to shut your pain down for the best way I can so that you can get relief and feel much more comfortable. Then at that point, I'm going to start introducing functional improvement in their life. It's not just pain relief, but also functional improvement. That is, getting the patients back to their job, back to doing what they love doing. It makes a whole lot of sense. Now, you'll oftentimes hear numbers thrown out there. Well, I can only get 3 in a year. I can only get 6 in a year. Typically, it really it's based on how many milligrams of steroid that we're giving you. Because studies show if you continually give patients steroid injections after steroid injection, after a certain amount, typically it's 3 in a short period of time, if you keep giving them, really there's no improvement. You're not really imparting the patient any more improvement. And I've seen patients actually almost become, and I'm going to use the word loosely here, addicted to steroids. In other words, they feel a lot better. They get that little bit of euphoria from it, and they keep thinking that this is what they should be getting, almost a steroid injection every joint in their body. And I've seen this, and it's kind of disturbing because there are other alternative medications that can be used. Physical therapy definitely has to be used along with these injections. You have to do something to help the patient improve their functional abilities. So that's key to any treatment plan that we have, whether it's a steroid injection or not. And there's even a small amount of patients who actually have a sensitivity to these steroids that we give. So we have to come up with different ways in order to provide the relief that does not use steroids. And one of them is something called prolotherapy, which is P-R-O-L-O. It's very interesting. It's been out for a long time. It's basically using a concentrated sugar water solution in place of the steroid. And in some cases, I've been able to get just as good relief with that, especially with patients that are allergic to the steroid, or they say they have some type of sensitivity to it. So again, when you have these questions, you really should be talking to your pain practitioner. If you don't get the answers like, what are my goals after one injection? What am I looking for? How much improvement should I have? If it's just a automatic injection, regardless of whether you got improvement or not, you really should start questioning why you're getting these injections. You should start seeing a progression in your pain relief as time goes on. If you don't, then it's probably not a safe thing to keep doing. Well, that's all we have for today. Thank you for joining us again.
And our next video on Sunday is going to be really good. It's one very close to our hearts because we have some friends that are going through the same problem, but it is what is life like after a prostatectomy.
Mm-hmm. Yep. Hope you can join us. See you later.